As the old saying goes, an apple a day keeps the doctor away. But not everyone is given the same quality of apple. Poverty limits to health care because some people aren't able to have the amount of money or income to afford things that they need in order to survive. Today we will focus on 3 areas we as a HOSA chapter and the HOSA organization as a whole can make a difference to improve health of entire communities. These areas are reducing prevalence of discrimination and racism, understanding proper nutrition, providing health education early and often. Health education, you can start them young. Teaching them while they're young in homes, parents need to teach their children healthy basic habits such as maintaining a good sleeping schedule, good hygiene, and healthy eating habits. They should be learning as they grow up so they can teach their children as they did the same for future generations. Many professionals believe that low-income families do not understand proper nutrition, thus making their education their go-to answer for poor nutrition for those living in poverty. Although education is a key element to improving nutrition, it is not the only answer. Priya Fielding Singh, a sociology doctoral candidate at Stanford, wrote that families' socioeconomic status affected not just their access to healthy food, but something more fundamental, the meaning of food. In her research, Priya found that low-income parents will provide junk food when requested by their children as a token of their love. Parents who can't afford expensive items such as video games resort to the easier, accessible, and inexpensive food to show their love. The National Institute of Health describes time poverty as another key element to proper nutrition. Parents and older children who may work multiple jobs provide income, thus leaving little time for cooking healthy meals. It is faster and easier to heat up packaged processed food than chop up fresh vegetables and cook healthier meals. From these points, our team learned that we can take multiple aspects of nutrition into account and provide the most relevant solutions. From our research, we have compiled 3 tasks that HOSA chapters can undertake to improve the nutrition of those living in socioeconomically depressed conditions. Education. Working with local agencies, HOSA chapters can develop short presentations that are appropriate for different age groups, starting with young children, provide information of what good nutrition is and why it is important. The program should be geared to the age group by using various techniques. Coloring books, interactive videos, games, and cooking classes are just a few examples. The approach needs to reflect the ability of the learner. Teens and parents can be provided information through interactive websites and phone apps, in-person cooking classes, or books. Food banks. HOSA chapters can collaborate with local food banks to regularly help stock their shelves with non-perishable food items. Chapters can also work with area farms and grocery stores to develop fresh food bank. A surplus fresh foods such as fruits, vegetables, and meat can be provided to food insecure families to supplement their groceries. Many schools have created programs such as Blessings in a Bag to provide to students who would otherwise go hungry on weekends or breaks from school. HOSA chapters can create such a program in their schools or join forces with another local school to make contributions. HOSA chapters can operate an in-school grocery store where students needing assistance can get healthy food to eat for lunch or take home to their family. Increasing awareness. The commonly used statement, "out of sight, out of mind," can be utilized to describe the lack of knowledge of those who have access to healthy food to the plight of those who lack equal access to healthy foods. HOSA chapters can create public service announcements that help raise awareness for the need of food donations to food banks. Public service announcements of where to find those in need can also be created and aired by local news stations and radio. These chapters can also make presentations to the local government agencies and community action boards to request or offer assistance to information the community of the needs of all their citizens. Increasing awareness should be directed to both those that need help and those who can offer it.
The third area we want to talk about is discrimination and racism. You can change these by enhancing income and employment, ensuring access and care for all, improving neighborhood housing and conditions, and reducing childhood poverty. Research has shown that improving these problems will improve the health system. HOSA can change this by engaging into these problems and finding solutions. Each member of HOSA must take a stand against racism through his or her daily actions. We can support minority-owned businesses. By doing this, we can provide the owner with the financial resources to provide more health benefits to their employees. Our HOSA chapter can work with community leaders to conduct social research projects with the goal of properly providing information and access to reduce discrimination and racism. HOSA can collaborate with our community leaders to develop programs where young children interact together to lessen the impact of negative influence regarding discrimination and racism. Together, we can be agents of change. We can help provide everyone with quality healthcare opportunities. The apple is access to quality care. The apple that keeps the doctor away can be the highest quality for everyone.